Hey everyone, thank you for joining us. We are now getting ready to start our panel 3 discussion about colleague empowerment, and our wonderful graduate student group will be our moderator for the event, and I will kind of take a step back. So Roop, do you want to go ahead and take it from here?
Absolutely. Hey everyone, thank you for hanging in there. And I'm going to introduce our third panel of the night, colleague empowerment. And when I was thinking about doing this panel, I thought about Dr. Sayers and Dr. Narayan. Both of them worked, had their pre-doc and post-doc together, but are at different stages right now, but they're still so connected. And I'm honestly really, really inspired by that. Perfect people for this panel, 100%. Yeah. So I'm going to be introducing them briefly, but feel free to check out their bios in our comments. Dr. Jamie Sayers is a program manager and the clinical supervisor at the Portia Bell Hume Behavioral Health and Training Center. Her clinical interest focused around working with the underserved population. And to join Dr. Sayers, we have Dr. Narayan, who currently works at Kaiser Permanente Department of Adult Psychiatry, and she focuses a lot on reducing mental health stigma among the South Asian, refugee, and the immigrant community. Really happy to have both of you here, and let's talk about the importance of how good it feels to feel connected. And, I would say this is a very competitive field, and just pointing out how great it's have to have that connection. Yeah, so I'm going to jump into our first question, if that's okay.
Absolutely.
All right. So my first question is, I wanted to know what made both of you want to continue this friendship despite having a busy life. We can start with Dr. Narayan, if that's okay.
Sure. Thank you, Roop. Thank you for that. And I guess for everyone who knows Dr. Sayers, you just can't stop interacting with her. I mean, she just has this amazing way of connecting with you. I remember the first time I met her at the Hume Center, and this is after 2 practicums, being an international student in a school where there was nobody else that looked like me, that kind of spoke English the way that I did. So I think I kind of went into the Hume Center with like really expecting something to change there for me. And she just walked up to me and she was like, "Hey, can I tell you a little bit about like Lord Ganesha? I've learned about him and I was like, and even the way she pronounced my name. So the small things with Jamie kind of kept me connected. And I think and then of course WWF, that was the one thing that I used to watch back home, and I was like, so and so, and she's like, oh my god, yes. And so I think that's what's kept us going is Jamie can just like make you feel like any topic is welcome. And and we always connected back to our work with the community that we do. I mean, she currently supervises the South Asian program at the Hume Center, so it just speaks to her versatility and how she can be so welcoming. So I think with Jamie, it's who she is. It's really difficult to like not stay connected with her.
Absolutely. I agree with that, Dr. Sayers. Any thoughts about that?
Yeah, so it was, it can be very nerve-wracking when you're starting, any kind of practicum site, or anything like that, just wondering who you're going to be able to connect with. And I just happened to pick the computer next to Nithya, and I saw that she was, in between doing some work, she was watching cricket, and I had no idea what cricket was, how the game goes. So, through, our breaks, whatnot, she taught me about cricket. I taught her about American baseball, and like she had mentioned already, we found out that we both love WWF, so having those connections. And I think our agency as a whole is just very family oriented. So, lots of times spent with potlucks and holiday parties, whatnot, and celebration. So many different cultural holidays that I've always valued about working at the Hume Center. And then you're in a workroom with somebody for a year, spending, 5 days out of the week. So it's really hard not to connect with people. But, Nithya is such a positive individual, and, the walls could be caving in and she would just kind of stop and be like, what do you need? How can I help you? In a very calm, cool demeanor. So I've always appreciated that. And I think that's just kind of, it was a way we were able to form our bond, and we've kept that going, even though we're not employed at the same place anymore.
That's so good to know. I feel like in addition to the workroom, the shared workroom, it's honestly the sports that connected you guys. So it's nothing about psychology. It's baseball and cricket.
Yeah, absolutely. Yeah.
I love that you also talked about supporting each other and how difficult and challenging it can be to just enter into this new situation. And you're usually coming in alone, not necessarily with friends. So being able to be open and connect, I think, is absolutely fabulous and something that I think a lot of our viewers will value.
Yeah. Similarly, a lot of graduate students had questions about having the feeling of imposter syndrome and always, feeling that they have to do more. Is this something both of you resonate with? Dr. Sayers, if I can point you, if you have any thoughts about it.
Yeah, I think when you look at it, I mean, I think the first time I heard someone call me doctor, even though I know my last name, I had to double take a couple of times, and I was like, "This is the doctor." Oh, you're talking to me, and kind of going back and forth with what that means, and if somebody's addressing you that way, and feeling a little bit of pressure in that sense too. So I think that when you're looking at just this idea of imposter syndrome, I think there is a lot of pressure, like anybody in this field is, definitely we have this feeling of needing to be higher achievers and this pressure to almost feel like you need to be the expert in so many areas. But I think, as I've gone through my career and, still very early in it, feeling like it's always going to be a learning process, and that, we learn from our colleagues, we learn from, our colleagues, our peers, our clients, and, just kind of always being open to learning and realizing you don't have to be the expert. You don't have to know everything. So that's at least what I've been able to take from it. So it's kind of having to check yourself every so often when you start to feel that pressure of being like, okay, I have to know the answer to this, or I have a supervisee coming up to me and they're asking me for something, I have to get it done, and I should know all of the answers, and just having to really check in with myself from time to time and to alleviate some of that pressure.
Yeah, absolutely. Anything else you want to add, Dr. Narayan?
Yeah, no, I completely agree with Dr. Sayers. I also think I resonated so much with I think what Dr. Rodriguez, Dr. Sabharwal, and also Dr. Fan were talking about. I think the not knowing and getting comfortable with that, because it felt, especially as somebody that was immigrating here, always felt like, am I wasting resources? Am I wasting time? Am I wasting money? So it's constantly keeping that at the back of my head to make sure that every step that I take is worth it. And I remember at the Hume Center when we would do our consultations, and there was this kind of like almost being comfortable sitting with not knowing. And there would be days where it was just uncomfortable for me to even like picture that for myself, because I think there was this inner voice that kept saying that's not okay, or that's in some way wasting resources. So I think getting comfortable with that self-compassion that Preet was talking about, being able to let myself know that, enjoy the process, that I had the opportunity to make it through, and reminding myself of that consciously. I remember making little Post-its and writing it for myself, because I needed to kind of learn how to enjoy the process while still keeping the focus on the outcome of graduating. Yeah. And I think also learning how not to minimize, because that imposter syndrome sometimes, and coming from from the Asian culture, like there's sort of this internalized way to like not speak about your accomplishments or speak about your achievements, and learning how to position that in your in your resume for internships, or in your write-ups or practicum. That was a huge, like, talking about myself was not something that I'd ever done. So I think I noticed that was another space where the imposter syndrome kind of swept in, but recognizing it was my first step.
Yeah. Thank you, both of you, for being so transparent on this. I think the huge takeaway that I personally resonated with was, being kind to our own self, and also recognizing it's a process where there might be moments where we don't know things. And, sometimes we lean on to our supervisor. I know Dr. Sayers was my supervisor, and I just expected her to help me every moment. And I'm glad I'm learning this process from both of you.
I think it also speaks to your humanity. Like, who knows everything? No one is a walking Google. And so, imposter syndrome is something that comes and then it goes. And I think what can be really helpful is knowing that when you hit that mark, it is kind of like a sign that you have arrived because it's true. You're doing something brand new and you might initially feel like you shouldn't be there or do. But the reality is you're exactly where you need to be and you are doing something amazing and no one has all the answers to everything. So it's a growth period.
Right.
Yeah, absolutely. Gonna talk about another topic. Might be a deep question, but have either of you had experiences of facing microaggressions at work? And if so, how did you deal with that? I'm going to ask Dr. Narayan first.
Sure. I would say, have I experienced, I think all of us have implicit biases. So I would start with that. I would say, yes, there were my own coming into this space and being part of a diverse school. So, I mean, kind of first starting with the grad school, I would say there was a bunch of my own biases that I had to kind of be aware of. A lot of it came from just lack of exposure. A lot of it came from a space of like, what I knew from media and what I had learned and seen through media. So I think first recognizing that myself. And I think sometimes I also noticed this term microaggression was new to me because I'd heard about racism and and of course, coming from the culture that I do, it was let it be. Like, this sort of like, don't say anything about it, just, let's act like you didn't hear, let's not create conflict. And so even within the culture, when there were comments made about certain aspects of my identity, there would be this like, just stay quiet. So when I came here and I found out that there's a term for that, microaggression, I think that opened up a space for me to have a conversation with myself in my peer group at the Hume Center, or even within my own support group at Alliant that I went to school for. I also feel, I also think sometimes it's important to recognize it can be subtle. So by the time you even notice that it's something that was said, you lose that moment. And those are the ones that I feel like sometimes sit with you for a longer time because you kind of, it's that lack of closure and not knowing what you could have said or what you might say if this happens again. And that was something that I feel like has been a challenge even till this day. How do you address those that are just kind of past, the moment passes, but there's, that there was a comment there that wasn't comfortable.
Yeah. Wonderfully said, Dr. Narayan. I think some of them are really subtle and sometimes we fail to recognize how it affects us too. Right. Anything you would like to add, Dr. Sayers?
Yeah, I think it's, I've been fortunate in my current position to not have experienced that anytime recently, but certain things that come up, when you're, it's either, whether it's colleagues, whether it's professors, whether it's clients, and noticing your own reactions to them and, kind of being like, okay, maybe I'll kind of let that one slide, but certain things that pop up and it's kind of almost like a thinly veiled, it feels like a compliment sometimes. I remember the first time I heard, oh, you're very articulate or you speak very well. And I was like, oh, that's good. I have a good vocabulary. That's nice. But then like looking at the, what the meaning of that is and speaking well compared to who, and just, things that where you feel like, oh, especially with my name, I think with name sometimes where it's also very gender neutral as well. And then sometimes I show up and like, oh, I heard you on the phone. I didn't know you were Black. You didn't sound Black. Those kind of things. And then all of a sudden being very conscientious of like, okay, well, how do I sound? How am I speaking? What, is it not, stereotyped enough? That kind of thing too. Because, you can try to move it away from it in one direction and then you're kind of pushed to the other side. So it can become very overwhelming. And I think similar to like what Nithya was saying about how, experiencing that and then dealing with it, like, two very different things. I think for the most part, trying to just kind of sit back and process what's happening and then really thinking conscientiously about how you're going to respond. I think I always kind of have in the back of my mind, like not react very angrily, because coming along with that stereotype of like, oh, well, there's the angry Black woman again. I knew you were going to get, you know you're going to get offended. So I think kind of wrestling with that too. So then kind of like similar to Anithya saying, being like, okay, well, I'm going to be really quiet about it, or I'm not going to be really reactive. But then, what does it mean to kind of have a conversation, with people about it, especially coming, when it's with your colleagues or between your supervisor or whatnot, should you just kind of let it pass? Or, what is the appropriate time to kind of bring that up and then have a, a healthy conversation, an open conversation about it?
I would ask to just add on to that, if I could. Given the time period that we're living in, with a lot of the unfortunate situations and some of the fortunate changes that have been occurring, do you feel like this experience or these conversations are happening more? Do you think they're happening more even at the graduate student level? Because I know there's a lot going on in terms of the professional level, but are you seeing this, and are you supporting each other in having these, dialogues with peers?
Yeah, I think we've definitely had, in our bigger kind of like consultations within, with the supervisors, with our teams and different cohorts, we've definitely had those conversations. They've come up and people have been really open and honest about their reactions, and even people coming up to me and others individually about like, this is happening. I'm not sure what's going on, but I have these questions. I want to be able to talk to you about it. Am I offending you if I'm asking this? I think people are very trying to be very honest and open, but also not wanting to be. I'm definitely seeing it coming up a lot more, but I'm thinking it's feeling like people are coming from the idea of wanting to be a learner and wanting to, address maybe some biases that, they've had in the past, and we all have them, whether we, admit them or not, or whether we see them or not. So I do like the idea of it just kind of being this open dialogue, and, where people are like, okay, I'm going to, respect what you have to say. Here's my opinion, here's yours. We don't have to be, but we can have that open conversation.
Yeah. And I think I totally echo what Jamie, and I would also say sometimes the struggle that I have, especially with grad school, is sometimes the way that it's discussed is in a larger group, and there may be diversity in terms of how comfortable certain students may be with expressing their views in a group. So if there was the opportunity to also open up a one-on-one or create a smaller group discussion, I feel like there would be more there would be richer like conversations and more focused on microaggressions within subcultures when it comes to certain topics, because that voice still doesn't get out and doesn't seem to be out there. So I would say within Kaiser, it is something. I mean, it's a shame, but they recently they started out the inclusion and equity committee. I mean, it had to take a lot for that to happen when when we know how long Kaiser has been around, but it took the voice of a lot of clinicians of color to say we need to have this. Besides the union, where some of the topics kind of go to when it has to do with microaggressions, we need a committee that will speak to this. So I think I'm hopeful, but I also hope there's more acknowledgement to how it's done, so it can feel safe for people to talk about.
Thank you.
Yeah.
Absolutely. Considering how candid both of you have been about talking about your identities and, what's the current political climate as well, I'm thinking if both of you have any suggestions for graduate students to talk openly with peers or with supervisors about, their heritage, identity, or anything else that comes to your mind. Can we start with Dr. Narayan?
Yeah, sure. I would say the first thing that comes to my mind is it's time to unmute yourself. I think it's really time to utilize the opportunity that whether it's approaching a supervisor or maybe even a fellow clinician at work and having a candid conversation with them, being able to, like I have a colleague who says, it's okay to step on cow pies. like say it and then learn it, and it's okay, because sometimes you can kind of get caught up in how do I say certain things, and the intention is pretty clear when where you distinguish between curiosity from racism or microaggression. So sometimes it's important to just say it and have an open conversation. I would say that's where I can totally I've done that with Jamie a lot of times, where it's what do I say, like what term may feel more safe to talk. And so we've had those conversations at the Hume Center. We continue to have that with your peers, and not kind of diffuse that to like somebody else will take care of it. Because if you don't do it, then then that voice doesn't get heard. So I would say just unmuting yourself is that first step.
Yeah, I love that tagline, unmuting ourselves to have these uneasy conversations. Yeah. Dr. Sayers, any final thoughts about this?
Yeah, I mean, I don't want to echo too much of what Nithya is saying, but it's just kind of like it's open. We need to be open, and we need to start these conversations. They need to be happening. And I think a lot of the pressure that I noticed seems I can only have these type of conversations with people who identify similarly to me, the same level as me. So it's like, oh, I don't want to bring that up with my supervisor. Maybe I have to be seeking to appear on the same level, so to speak. So, but then, you only get like these small pockets of information shared. So you're communicating with the same people about the same thing. So being able to be in a space where we're able to kind of broaden those conversations and connect more, because every conversation you're learning something about someone else, right? So needing to just be willing to be open, and there's not always a right answer or a wrong answer, right? But just or to not take things personally, right? You might perceive something as offensive, and the person may have not meant to offend you. How can you move past that? Is it helpful to just write that person off? You're not really making any progress there. So how can you move forward?
Awesome. Thank you both so much for sharing your thoughts on this. And I think that it's really important, just that last point that you made around what do you do in these difficult conversations? And if we're, just a thought, teaching our patients to have these difficult conversations and to experience these challenges within themselves and with others, we kind of have to be able to do the same thing. So really appreciate you pointing that out.
Yeah, similar to Dr. Ball, I just want to thank both of you for your time. And I love how your bond grew from sports to now being colleagues here and doing this panel together. But thank you for talking about, I realized some of the questions were really deep. So really appreciate your willingness to talk here.
Thank you.
Thank you.
Thank you.
And with that, we are going to wrap it up and move on to our fourth and final panel. But thank you so much for joining us and for sharing your awesome insights. I really appreciate it.
Thank you.
Thank you so much.
Thanks.